job is a therapist, so I spend most of my hours during the day meeting with individuals, and so there might be times in which I reference things that I talk with my clients about, or even some experiences that I've witnessed. And obviously, I won't be using any identifying information, but a lot of the kinds of ideas and metaphors that I like to use when unpacking what emotions are come from that experience and come from the work that I do in a clinical sense. So, without further ado, the main ideas that I want to sort of explore with you all is what are emotions? What role do they play in our lives? Two, how do emotions show up in our body? What are some of the signs? What are some of the ways in which we can recognize them? And finally, how can we listen to our bodies and our emotions more deeply? How can we glean what sort of messages our body is trying to tell us? So to start off, I'd like to just go through some basic terminology, and I don't want to get too hung up on the nitty-gritty of using the precise words, but mostly actually paying attention to how the language that we use reflects the ways in which we understand emotion. So, for example, um, emotions and feelings uh, that these are two words that can be used interchangeably a lot of times. And, to be honest, sometimes I use it interchangeably, but to sort of create a little bit of nuance of their what different aspects of the emotional experience these words are tapping into. Emotions mostly refer to that automatic gut reaction, sort of that feeling that comes up when we have some sort of emotional response. It could be just sort of that little pinch of anxiety or of feeling sad or frustrated. There's oftentimes a physiological arousal, and it's often sort of very rapid and temporary, that it occurs in the part of the brain that is that deeper part, what we would call the limbic system or the amygdala, the parts of the brain that are responsible for some of those automatic functions, things like breathing, heart rate, fight or flight response. So that is sort of more of what the emotions are, uh, uh, the word emotions is trying to capture, whereas feelings is more of the cognitive processing, the sort of interpretation that we put onto those gut reactions, those physical feelings, that when we allow ourselves to reflect and look at our experience of, oh, I am feeling sad, or I am feeling anxious, or I am feeling fill in the blank, that once we start to attach some of those words to our experience, that's when we start to feel our feelings, that it requires a certain level of awareness, of processing, and it can be a lot more sustained and a lot more higher order thinking. Another way to sort of think about it is that um, emotions, or that emotions are the reaction to a stimulus, and the feelings are the interpretation of that experience. Kind of like emotions are the raw materials, feelings are sort of the refined results, or the refined sort of end product. That uh, Oftentimes we use these words sort of synonymously, and I think that semantically it's usually fine. It's not like you're getting into dangerous territory with sort of switching these words around. But I think what's important about making that distinction is that even though our emotional experience can happen in the blink of an eye, there's a lot more that can happen in the wake of that emotional reaction. And that is still part of the experience. That just because the emotion is fleeting does not mean that the experience is over. And I think sometimes we can get down on ourselves if we feel like, oh, I'm, wallowing, or I'm, sort of, why does this still bother me? Or why am I still thinking about this? Why, can't I shake this feeling? That the feelings are still trying to make sense. Sort of the refining process is not done with those raw materials. So you might be familiar with the six basic emotions, and to be fair, sometimes there are all sorts of different other emotions that can be added to this basic set. Things like contempt or guilt or shame, interest, pride, love. There's a lot of very basic emotions that can be sort of grouped in. Um, but what is important about recognizing just basic emotions is that this is a human experience. It sort of goes across different cultures, that there are cultural differences in terms of what kinds of emotions are are highlighted or validated or appreciated. There might be different ways in which those emotions are um, talked about or show up in story or in communication. But all cultures have some level of understanding of different emotions, different basic emotions, and that these emotions are present from a young age. Even in sort of the first couple years of life. That is when we start to develop our emotions, our emotional awareness, and our emotional expression. This is a tool that I use with a lot of my clients who are having trouble being able to identify their own emotional experience, to be able to process their emotions, and to be able to process what they're feeling. That, as you can see, sort of in the middle are some of those basic emotions, like I was referring to. And as you sort of go from the middle outward, you start to get more and more nuanced, more and more descriptive terms. So things like creative or thankful or irritated or mad or enraged, that the different words help to differentiate between varying degrees of intensity, varying degrees of closeness to how we feel to one another or to ourselves, that these words help to fill out our vocabulary, almost like we're learning a new language. And oftentimes I sort of frame it that way to my clients, that when you haven't spent a whole lot of time, or perhaps you haven't been in an environment or your family wasn't very emotionally expressive, oftentimes we can have a very limited vocabulary, a very restricted vocabulary. Um, and that this is often because we just haven't been exposed, just like with any other language that you are learning. The more you read, the more you talk with other people who are native speakers, the more that you start to use the language, the more that your vocabulary expands. Oftentimes, I use the analogy that uh, developing emotional vocabulary is kind of like what it's like for toddlers in that early life experience, where people talk about the terrible twos or terrible threes, where there's a lot of tantruming, a lot of dysregulation. That what's going on at that age is that you have this person who their emotional center is coming online, but their vocabulary isn't there yet. And so, if you can imagine what it feels like to be a toddler, to be a 2 or 3 year old who is feeling some of these feelings for the first time, but doesn't have the words to express it, just how distressing it can be in that moment, or in those moments, to feel something so foreign, but not to be able to communicate it to your parents, your adults, being able to put words to what our experience is so vital to being able to regulate and to be able to um, manage our own emotional experience. Another couple of definitions that can be helpful to refer to what emotional experience is mood and affect. Probably words that you don't use quite as often, but might still come up here and there. That mood refers to the internal feeling states that is sort of pervasive and sustained, sort of the general vibe that you're feeling on a you know, longer term basis, um, that you might feel, depressed, or you might feel good, you might feel positive. Affect is more of the external sort of signs, the external sort of markers of what you're feeling in the moment to moment experience. And it's more of the objectively observed sort of features. Often mood and affect are more clinical terms that we use in diagnosis or in sort of a clinical setting to evaluate. But an easy way to sort of think about it is that mood is sort of the climate of what you're going through or how you're feeling on sort of a larger basis, and affect is sort of the weather, how you're feeling in this moment, what's going on right now. That the weather can change, day to day, but the climate will sort of change in seasons. That there might be a season of life where you're feeling, more content, feeling more on top of things, and there might be seasons of life where you're feeling a little bit more overwhelmed. You're feeling a little bit more sort of busy or stressed out or depressed or going through a time of loss. Um, that there are these larger trends of how we feel on a longer term basis, and how we feel in the moment that can change sort of day to day or even moment by moment. Some different myths that I think can come up about emotions, I think are important to acknowledge and to sort of understand why they might not be fully true. Are things like, there are good and bad, positive and negative emotions that uh, the judgments that we put on whether an emotion is a good emotion or a bad emotion or a positive or a negative emotion are really our own subjective judgments of how those emotions make us feel, whether they make us feel comfortable or uncomfortable, whether we like them or we dislike them. Um, but, I think even the emotions that we might feel as more negative still serve a certain role. That when we feel angry, when we feel sad, when we feel anxious, those emotions are still doing a certain job. And to recognize that just because they make us feel uncomfortable doesn't mean that they're abnormal, that, everybody will feel anxious or sad or angry from time to time. We don't want those emotions to cause us to behave certain ways that are inappropriate or unkind or things like that. But the emotions themselves aren't, necessarily what is wrong with us as human beings. Um, Another myth, there's a right way to feel in every situation, that there is no one right answer of how you're supposed to feel in a given situation, that uh, life is too complex to be able to nail down what the rules of emotions are. It is inauthentic to try to change my emotions. Again, sort of differentiating between the raw materials and the refined experience, that emotions just happen. We don't control emotions. Oftentimes, the analogy that I use is that emotions are like surfing. We don't choose what waves come in or go out. We can only choose which ways we choose to surf. That emotions will happen, emotions will come up because of the situation that we're in, but we can choose which emotions we spend our energy and our time dwelling on or processing or thinking about. My emotions are who I am, sort of feeling so identified with our emotions that we can't see ourselves as anything more than that. Emotions are important. It's why I have the job that I do, but it also isn't the entirety of who we are, that there's a whole lot that makes us who we are, that makes us human, beyond just emotions, that just as emotions aren't to be neglected, they're also not ultimate, not the final say. Emotions should always be trusted again. This idea that emotional truth is final, that experience is final. Um, Emotions provide a certain level of data, a certain type of data, um, but they are limited just like any other part of who we are as human beings, that our rational thought has a particular role in our life and our emotions have a particular role in our life. That doesn't mean that one is more important than the other or one is better than the other. It just means that they have different jobs. Um, that people should do whatever they feel like doing. Again, it's not to say that uh, emotions don't matter, but when they become an excuse for behaving a certain way, um, that is when we get into tricky situations of what is the role of this emotion? Is it to be able to sort of steamroll over other people, or is it a way to understand the world around us? So speaking of the different roles that emotions play, I want to talk about sort of three different domains, three different areas in which emotions are particularly useful and important for. The first is with motivation and automatic responses that if we had to stop and think about every piece of data that crossed our mind, it would be way too slow. It'd be way too inefficient. That at a certain level, emotions help to speed up the process because it is such an automatic response. That, for example, if you smelled spoiled food, and you just sort of like jerk your head away, that's sort of an automatic response. It might not feel like an emotional response, but that feeling of disgust is so automatic that sure, you could stop and slow down and think about like, okay, like I think this food is spoiled, and sort of to put words to it. But that automatic reaction happens without needing to take the time to sort of figure out, hey, what's going on? It just sort of connects the dots for us. Um, Motivation, one of the biggest ways in which our body prepares us for action is through hormones, things like adrenaline, things like dopamine and serotonin, that the different chemicals within our brain's biochemistry help to uh, prime us for action, to sort of push us towards things that make us feel good and away from things that don't. And that in itself, still needs to be tempered with a certain level of executive function and planning. But that uh, that feeling that we get when we enjoy something, when we're engaged with something, when we're passionate about something, the job that we're in, or the activity that we're doing, or the person that we're with, or that we want to be with, that is all our emotional system getting online and saying, I want to move towards that, or I want to move away from that. and responding to obstacles or emergencies or important situations that our emotions help us to uh, divert resources to the appropriate place, especially in times of emergency. And again, that immediate, quick processing that when our bodies, are responding to a threat, um, the body automatically shuts down temporary unneeded processes, things like um, our digestive system that doesn't need to be online when we're running away from something or when we're trying to focus on solving a problem or getting out of a dangerous situation. That there are certain parts of our body that don't need to be online in that moment, and the body just automatically and uh, immediately diverts the resources away from the parts of the brain and the body that don't need to be online towards the parts of the body and brain that do. A second area that is important, or that demonstrates sort of the role that emotions play is in providing information about ourselves, being able to understand the signals that come up, the ways in which uh, certain alarms are going off in our mind, certain intuitions that come up, things that prompt us to investigate further. Those are all emotional responses that we're getting, even if we don't necessarily have the feeling words to attach to them quite yet. That uh, being able to feel what's going on inside of our body, being able to notice uh, how a situation makes us feel allows us to sort of take a look inward of, what is causing me to feel this way, or what is going on, or how, what is my body responding to, or what is my brain responding to. Um, I don't know how many of you have had a check engine light come on in your car, um, and being able to know why that light is going on can mean the difference between, is this something, is there something electrical that, it's just sort of the lights coming on, or is there something serious that really needs to be addressed? Otherwise, the car is going to have more damage done to it. Um, that sometimes, depending on how our body has been conditioned, it might feel like that check engine light is coming on all the time. Or it might feel like, there's rarely a time where that check engine light comes on. But when it does, it might be alerting to something that does need attention or does need to be fixed. Um, that being able to know, like a mechanic, what is causing that light to go on, is the difference between being able to fix a car or just hoping and praying that your car will be able to keep you going. Last area that I'll mention is with relational bonding, that one of the main functions, one of the main roles of emotions is to help with our ability to bond with one another, to have connections, to be able to build friendships, to be able to communicate well. Um, that uh, Most experts agree that around 70 to 90% of our communication is through nonverbal means. So things like tone, body language, inflection, the different ways in which we carry ourselves, or the different ways in which we intuit what a person is saying, even if they're not being genuine to our face. Um, we can pick up all those things because our brain is so good at picking up on those emotional cues, that emotional information. Um, uh, Attachment, basically, simply put, is the safety that we feel with another person, that when we become attached to somebody, we feel a certain degree of safety or security with them. Um, that the stronger and the safer we feel, the more free we feel to take risks. That if you feel like you have somebody that is your person or a group that is your group, the more secure and safe you feel emotionally, the more able you are to take risks and to put yourself out there because you have a home base to sort of come back to. Um, and influence, being able, you mentioned sort of the leadership conference that you have coming up. Emotions are what drive connection in groups, in leadership, in following, what is inspiring or meaningful or passionate. Um, that being able to connect with your audience or connect with the people around you is a function of how you feel with them and they feel with you. That you could have the best advice in the world, you could have the credentials to back yourself up, you could have all the training and expertise, but if you don't connect with your group, or if you don't uh, uh, instill a sense of trust and safety, um, that influence goes to waste. Uh, So, an analogy that I like to use when talking about the ways in which we are connected or disconnected to our emotions is kind of like thinking about a floor plan of a house. That if there are certain emotional experiences that are uncomfortable for us or that we tend to avoid or that we tend to repress, it's kind of like cutting off or shutting down or boarding up a part of your house that uh, when we sweep things under the rug, when we avoid thinking about something, when we try to ignore how, that again, that emotional data that is coming up from us, it's kind of like just shoving it into a room and locking the door. And it might serve the function for the short term in terms of not being bothered by that thing, but then we lose access to that room of the house. We lose access to that part of our experience. And at a certain point, if we're just shutting down all these different rooms, all these different parts of our experience, we end up with less and less space to inhabit. Um, and that, uh, you know, in a worst case scenario, if it's something that is going rotten or something that is starting to smell, it starts to infiltrate the rest of the house. That when something goes unaddressed, when something goes unhealed or unfixed, that those parts of our house start to or inhibit the functionality of the rest of the house. That as difficult and as much work as it might be to open that door, to clean that mess, to be able to spend the time and attention to address what needs to be addressed, the ultimate uh, effect of that is that we uh, gain access to the rest of our house. How do emotions manifest in the body? I just wanted you to take a few quick seconds and think about, a time when you were happy. Um, what was going on? What did you feel like? And more importantly for this exercise, as you think about that experience and how you felt, what was going on, what feelings come up in your body? Um, we don't have a ton of time to get into it, but if we did, I'd sort of walk you through some different emotions, and possibly you might feel things very similar to this sort of heat map. This is sort of the different temperatures of how emotions can feel in our body. Um, and it isn't supposed to be sort of an exact science of, oh, if you feel this way, it's going to, manifest in this way. Some people feel opposite feelings where, some people feel warm, another person might feel cold. Um, and if that is the case, then, it might be that there could be multiple emotions going on at the same time, or it could be that there's a different emotion that you're not attuned with in your own body, or that maybe you do have a different experience of that emotion. But what I hope this sort of picture paints for you is that emotions do show up in different ways. Different emotions activate different parts of our body, that even though the emotional center of our body is in our brain, is in that limbic system, um, it manifests and it sort of shows up in different parts of our body, different aspects of our body. And so, once we start to notice the nuances and differences between how emotions show up in different places, that helps to close that feedback loop of understanding, and sort of picking out, like, why am I feeling the way that I'm feeling? Oh, perhaps I'm feeling sad or ashamed or depressed. That there might be certain ways in which tuning into the different sensations in our body can help diagnose what's going on that much quicker. A uh, common sort of representation of the way in which the different parts of our brain work together is what's called the cognitive triangle. That in any given experience or situation, we have thoughts, we have feelings, we have behaviors, we have feelings, which is sort of what we've been spending most of our time today talking about, the emotional experience, the sort of automatic feelings that come up, thoughts, that interpretive, cognitive, executive sense, that rational ability that we have to understand and unpack and recognize the different parts of our experience, and then our behaviors, what we do with all of that. And at any given time, all of those three are interacting with each other. That our behaviors can then sort of change or enhance or affect how we feel. Our thoughts can cause us to change our behaviors or not, or our emotions can cause us to behave a certain way, whether we like it or not. That being able to recognize the different ways in which our brain is not just thinking in isolated things, but sort of integrating the different aspects of itself is important for understanding why we do the things that we do. Another sort of aspect of experience that I think a lot of us can relate to, and isn't necessarily an emotion in and of itself, but I think sort of brings a lot of emotions with it, is stress. I think stress can be a very emotional experience for a lot of us. Um, and I'm just going to sort of go quickly because I'm running a little bit low on time, but I think a very helpful image of what stress can look like, and I think sort of uh, where stress can be even a good thing, is with what's called the Yerkes-Dodson law. That's at the bottom, you can see arousal or you can sort of also put in stress that when we have a moderate degree of stress, that's kind of like the sweet spot of feeling engaged, of feeling interested, of feeling a certain level of challenge. That if the stress or the arousal is too low, then that is when we feel bored or uninterested. And when it is too high, that's when we feel overwhelmed, burnt out, anxious. That a certain level of stress is helpful, useful, and even good. Um, but sort of going to the extremes of too little or too much is when the stress isn't fulfilling the role, fulfilling the function that it should or could. Applied it to more of an emotional sense, that sweet spot of where emotions uh, live in a harmonious balance of being able to have access to our rational mind and our emotional mind is what we call the window of tolerance. That when we feel an emotion, when we say feel angry, for example, that if we are feeling under aroused or hypo aroused, that we don't have access to that anger and it might be more repressed. It might be that we truly do feel a certain way, but we aren't allowing ourselves or giving ourselves permission to feel that way. And on the flip side, if that anger is overwhelming or taking control, that we can't calm down or we can't uh, de-escalate ourselves, then it is uh, overstepping the bounds of what we are able to tolerate and integrate. Um, that sweet spot is that middle ground of being able to have access to both parts of our brain, the ability to feel what we're going through and what's going on, and the ability to stay connected to our own rational thought and what is wise in this situation. Another way in which emotions can show up as in mental illness that for some cultures that stigmatize mental health and mental illness, oftentimes it's not that those mental ailments don't exist, things like depression or anxiety. It's not that they don't struggle with them, but they can show up in things like headaches or uh, IBS or restlessness or difficulty sleeping, that all those things that might feel like physical symptoms, and they are, could also be a signal that there's something going on at a mental psychological level as well. And so there's three things that I want to talk about in terms of what can we do to be better students of our own body, to listen well, to be to pick up on the messages that our body is trying to tell us. The first is to be able to observe non-judgmentally, um, to be able to be curious about our own experience without uh, being ashamed or condemning ourselves of how we should or shouldn't be. Um, Another sort of word for observing non-judgmentally is mindfulness. I think a word that often gets thrown around in vogue these days. And mindfulness is just basically paying attention to where you are at in the present moment. That the ability to draw your attention that is so often just running automatically in the background of all the different things that could occupy your mind, all the different things that you have to attend to, that when we slow down and become mindful of our present experience, that is a way in which we can observe, you know, like that heat map sort of showed the different temperatures in our body, the different sensations that we're feeling, the different ways in which emotions might be manifesting. The second thing is being able to self-reflect, giving yourself the permission to feel what you're feeling. That again, that automatic emotional response is going to happen, and the more that we try to shut that down, the harder it fights back. Um, Oftentimes, I use the analogy that, um, when we have a difficult or uncomfortable experience, it's kind of like holding a cactus. It kind of hurts, it pricks, but if we grab it too hard, if we try to control it, it will only poke us further. That the easiest way to hold a cactus is lightly, gently, openly. It'll still hurt. It doesn't make the anxiety or the depression or the panic any less painful, but it's more painful to try to crush and control it. Um, the last thing is self-compassion, the permission to be yourself, to be human. That self-compassion is not about tricking ourselves, it's not about coddling ourselves, it's not about lying to ourselves. Self-compassion is about seeing ourselves accurately. That when we see ourselves as fully fledged people with emotional parts of ourselves, with rational parts of ourselves, we have access to the whole house. We have access to the entirety of our experience. Uh, and recognizing that the entirety of our experience includes both pain and joy. That it's not just all the comfortable parts, it's not just all the positive parts, but it's also the parts that are difficult, that grieve us. Those are the parts that we so often try to excise from ourselves or to exile from ourselves. But when we have compassion on those pieces of ourselves that we so often try to push away, that is when we can fully be ourselves. Right. Well, hopefully I left enough time for questions. I don't know exactly how we'll do that, but yeah, I'd be happy to answer any questions that you have.
Thank you, Dr. Lowe. Such a wonderful presentation.
Absolutely.
Learned a lot.
Mhm.
And I definitely feel like this is part of the self-care for sure. And
Absolutely.
yeah, the importance of like recognizing how emotions manifest in our bodies actually can help us to better understanding ourselves and
Mhm,
also most importantly the people around us. So I
mhm.
really appreciate how you share what you shared tonight.
Yeah.
So does anyone have any questions for Dr. Lowe?
Can
Jerry.
go first? Yeah. So I think the last point you mentioned, great.
Mhm.
It sounds reasonable, uh, but how can we exactly do that to achieve that? You can give us some specific examples of stories.
Sure.
Thank you.
Yeah, no, absolutely. Yeah, I think allowing ourselves to feel our feelings, I think uh I think the word that I kept coming back to and that I often come back to is permission. That I think so often we have these expectations on ourselves of how we should or shouldn't feel. Um, and I think that uh, in those moments where we feel like we're disconnected or we don't know how to proceed or we feel overwhelmed, that I think sort of the first step is giving ourselves permission for it to be what it is, without feeling the need to change it right away. That I think oftentimes our knee-jerk reaction is to try to escape it as quickly as possible or to get through it as quickly as possible, which I think is a very normal human reaction. But I think that when we give ourselves permission to just be in that experience as sucky as it is, that then we start to hear the kinds of things that our body is trying to tell us, whether it's, a part of ourselves that we've neglected for a little while, or it's something that can't be escaped, but rather gone through. Um, I think an example that comes to mind is, when we go through a period of grief, um, that when there is a loss that happens that uh, is inevitable, that we all go through losses at different points in our life. That, I think, those last 3 points, I think if I had to just summarize it in one sort of word, it's sort of giving yourself permission to feel that loss, to feel that grief, to go through whatever process you need to give yourself time to heal in that moment.
So I actually have one question. I didn't see anyone post it, so I'm just going to ask all the
Mhm.
questions I have because this is an interesting topic. And then so I feel like because now the CBT, the cognitive behavior therapy, actually is so popular now. Not just
Mhm.
now, it's been a while. And then
Yeah.
the cognitive triangle actually remind me of that. Is
Mhm,
this
mhm.
foundation of the CBT?
It is, yeah. CBT sort of has gone through a lot of iterations, and so that triangle is sort of a foundation of what's sort of called second wave CBT, where a lot of it is sort of the uh, analytical sort of exercise of being able to understand those different points of it. Um, Sort of the more recent wave, what we sort of call like third wave CBT is, sort of what I added in the last 3 slides of, not just looking at it from a analytical perspective of like, how can we fix this problem, um, but sort of uh, bringing in other sorts of influences, from like Eastern philosophy, things like Buddhism and mindfulness, things like acceptance, things like being able to just sort of understand our experience in the moment, that there, it's sort of ways to expand on that triangle. So yeah, it's, that definitely you're on the right track in terms of, that's sort of where I pulled that triangle from. But sort of where we're at in sort of the evolution of CBT treatment and philosophy is that it's just continued to be built on in terms of integrating not just our brain but our whole body.
Yeah, totally makes sense. And we have one questions from audience. So,
Mhm.
um, is there a benefit to feel the feelings physically? Does that help us deal with the emotions better?
Yeah, no, that's a very good question, and I probably should have gotten a little bit deeper into that. Um, oftentimes, uh, I think one of the benefits, and I think there's multiple, but I think one of the benefits is that um, when I talk with my clients uh, who have difficulty articulating what's going on for them in their distress. When they come to me and they say, "Hey, I'm feeling stressed out," or "I'm feeling sad," or "I'm like not as motivated as I used to be," like I'm not as engaged, or I don't feel like I love my partner the way that I used to. That when there are these questions of why am I feeling what I'm feeling, or why am I stuck? Why am I feeling these ways? Oftentimes, some of the ways that I tap into that is through the body, is through those physical feelings. And so, I would almost like reverse that question in terms of it's not as much a benefit for the physical body as much as it is a benefit for the emotional health, that um, it's almost like a backdoor into the uh, the emotional experience of why are you feeling what you're feeling, that if you're coming and saying, "Hey, I'm struggling with this," and kind of like that heat map thing of, if we can identify in a different way what you're feeling, then again, it's sort of putting words to giving you vocabulary for what's going on. Um, and once we have that vocabulary, then we can diagnose like, okay, well, where do we go from here? Uh, now that we understand that, you're not crazy, you're not just feeling these things because something's going haywire, but there is truly a good reason for why you're feeling what you're feeling, then what can we do about it? That we can't sort of fix something if we don't know what's wrong. I'd say the second thing, and without going, too much into it, but I think the second benefit of feeling things, at a physical level is that it provides sort of a pressure release. That Going back to that house analogy, that if we don't, sort of the consequence of not allowing ourselves to feel those things, that when we try to shut down that part of our, of how our body has been designed to function, that we are essentially repressing or uh, sort of shutting off the body's capability to process that emotion in a natural way. And so it could have, physical repercussions in a different way, even if it's not necessarily related to, what's causing it in the first place. So, I would say that the benefit physically of, being able to be in touch with our emotions is in a preventative sense of, making it so that we're not repressing things that need attention.
Yes, yes. Thank you, Dr. Lowe. And so we probably still have like a couple minutes. And can you briefly introduce your podcast in case
Sure. Yeah,
everyone's very interesting in more
totally.
information?
Yeah, so thank you. Yeah, my podcast is called Hard Questions, No Answers. And partly it was my excuse to talk with really cool people. Um, that I sort of had the idea of this podcast back in 2020. Um, and at that point in time, sort of the cultural factors of just sort of the election and just sort of the pandemic, it felt like a lot of people were looking for answers. And I wanted to create a space to sort of resist that pull or that temptation to come up with easy answers for very difficult questions. And so, my goal with that podcast is to focus with my guests, and it's sort of an interview style podcast, but to focus on their experience of wrestling with those difficult questions without sort of the need to necessarily answer those questions. And so my hope is that it's more of an experiential conversation of, what is it like for this person to deal with this question. And so it's been things like I'm trying to think what I have released, because I've done some recent interviews that have been really fascinating. And maybe I'll give you sort of a sneak peek of what I plan to release in future episodes. But was talking with somebody about dealing with cancer. I was talking with somebody about dealing with finances. I was talking with somebody about infertility, like all sorts of different questions that I don't think have easy or quick answers, and that I think there's a value in being able to just talk about it.
Wow, sounds great. Cannot wait to subscribe. I did. So everyone
Yeah.
just check your phone and then it's on Spotify and Apple Podcasts, right? I believe so.
Yeah. Mhm.
And then thank you again, Dr. Lowe. And then we
Yeah.
have like a very rich presentation today. And then thank you so much for your sharing. And then if anyone has any questions, then you can just send us the questions and then we will collect it. And then that the Dr. Lowe help us. So if there's no other questions, I guess I wish everyone have a wonderful night. And then thank you again, Dr. Lowe.